Welcome to another episode of Follow the Brand. I am your host, Grant McGaw, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal story, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome. And thank you for tuning in to another episode on Follow the Brand. This is episode 13, and I am your host, Grant McGaugh. Today, we're going to have a special guest who's going to represent a lot of the early careers, people that are graduating out of their particular programs into the 2022 timeframe. Now, Jayson Forbes, he's going to graduate with a PhD in public health from Florida International University. And I had him come onto the show to talk about what his goals are as he steps into industry. He wants to become a Chief Innovation Officer, and he's going to detail the different steps and the different skill sets that he has to become a CIO, a Chief Innovation Officer in the field of public health. Now, Jayson Forbes is a health systems researcher and graduate assistant at Florida International University, born and raised in South Florida to two Jamaican-born parents. Jayson proudly is the first member of his family to pursue a doctoral degree. In his studies, Jayson researches patient safety culture, and care coordination. He aspires to one day lead a healthcare system that values evidence-based methods, continuous learning, and community engagement. Recently, some of Jayson Forbes' research was accepted to be presented at the 2021 American Public Health Association Conference, better known as the APHA. Jayson hopes to improve quality and access to care for people around the world. Let's welcome him onto the next episode of Follow the Brand. Welcome to another episode of Follow the Brand. I'm your host, Grant McGaugh. We have a very special guest, Mr. Jayson Forbes. He is currently a student at FIU. He's taken some courses as a public health, a doctor of philosophy in public health. He's chasing his PhD, and we're wishing him well on that endeavor. We wanted to bring him on the show and really talk about personal branding, talk about his personal brand and how he wants to use it as to basically manage his career going forward, manage himself going forward. He was able to take our online questionnaire that we have on 5-Star BDM on our website. If you haven't done it, I truly encourage you to do it. You can go ahead and tune in at www.5starbdm.com, and then you will just follow the prompt for the online questionnaire. This is something that Jayson just did, and it helped him. And we're going to talk about exactly what that looked like. So without further ado, I'd like to introduce Mr. Jayson Forbes to you. Go ahead, Jayson.
Hey, man. How you doing, Grant? I appreciate the opportunity to be here, man. I'm very grateful to learn from you, from my experiences of knowing you for the last couple of years, and my involvement in health services, and then continuously growing with myself and my career.
That's wonderful. And I believe, you correct me if I'm wrong, but we met each other, I believe it was at an ACHE event at Nova University. Is that correct?
Yeah, it was an event at Nova University and I think it was Microsoft sponsored, and they were going over different technologies with their software and their cloud services. So it was interesting to see that event, just because it was an empty seat and it was right next to you. And from there, it was a matter of just talking a little bit more and discussing. And then you brought me on and you started a little bit mentoring me a little bit more in terms of getting myself out there and acknowledging my brand and learning how to connect with people a little more. And that led to exponential growth of myself over the last 2 years.
Man, that's wonderful. I love to hear stories like that. You are now also a member of the National Association of Health Services Executives, and I really appreciate how you've been working on the committees there. I believe, are you also a member of ACHE or not?
Yeah, so I'm also a member of ACHE and American Public Health Association. Both are which I wish I can be a little more active on, but I am a member of those as well.
Wonderful, wonderful, wonderful. So you took the online questionnaire that I just referenced earlier, and you went through like a module of about 12 different questions. If you could just frame for the audience and what you got out of it and what you feel how you can utilize that going forward.
Yeah, so the questionnaire itself, it kind of breaks down and helps you understand who you are as a person, not even just on the career level or career side of things. There's parts of it that question your values. And then it kind of understands and makes you understand where you want to be with your career. So this kind of has this reflective feeling of bridging that gap between where you currently stand and what necessary steps you need to take to get where you are in your career. It kind of gives you that reflective idea of, okay, I know I'm here. I want to for instance, in your case, I want to hold my integrity. I want to work hard. I want to get my exposure out there and make sure I can do the best work I can do in this field or in this facility. So that way, in the next 5 years, in the next 10 years, I can reach where I want to be in terms of a goal or a certain accomplishment down the line.
Man, that's wonderful. And I'm glad you took the time to do it. So I want to ask you a little bit more, a deeper question, meaning how do you define your personal brand and how do you think it'll help you in your career?
Yeah, so my personal brand itself, I try to keep true to my nature of pursuing always some form of growth and learning. And I think you've kind of experienced that with me just with National Association of Health Services Executives. I try to learn from people there as well, because I know at the end of the day, I can only experience so much while others experience different areas and even different perspectives. That might help me learn a little bit more that I might not understand. I can see something the same exact way, same exact subject as someone else, but they might interpret it completely different. So just being able to have constant growth and learning is what I always push myself on. And it's kind of guided my career. Just with me deciding to go the route of a PhD rather than going for a Master's of Health Administration. But I still want to be in that executive level in a hospital or in a health system. It's just that the definition I want to see for myself and the purpose and the goal I see for myself is to be leading a learning side of everything. I want to be able to pass on my passion for learning and growth to the next generation and to communities. So that way people can understand what it's like to have better health. So we can put together interventions to make better patient outcomes possibly, or make healthcare staff a little happier and more satisfied and not as stressed out. You see a big thing now with burnout and moral fatigue. So to be able to put together interventions to help lower that so that providers can be at the best and at their most fit when they're providing and giving care. So as patients, that's kind of how I guide myself on the idea of just, I always want to constantly be growing.
I love that. I love that. I know when we went through, as you went through the process and some of the questions that you answered, you talk about having that continuous progress and that you utilize your creativity. You know, like your creativity, I believe that's like seeing outside of the box, seeing things differently. Yeah. That's a big strength for you, correct?
Definitely. I mean, even on the questionnaire, I think I asked about an ideal position. And I mentioned something that I don't know if much people my age mentioned. I mentioned a chief innovation officer for me, just because everyone, I think at my age and in my part of life, if they're going the same career path and they want to be executive, the first thing you think of is I want to be a CEO. whereas I have to be a CEO. And for me, I know that people are playing different roles, and not everyone has to be a chief executive officer somewhere to give value. For me, it's if I can be someone that comes in and I bring, and my sole goal and my sole purpose is to come up with interventions, and my purpose is to come up with ideas that help people that may not have been thought of before. I mean, I'm fine with it. That's what I'm passionate about, because now this brings me to the point of learning and researching and using the tools and skills that I've gained in my PhD progress right now, in that career, in that field, to be able to learn and see from different perspectives on how I can possibly improve access to care. As you're going forward, you're going to see things with technology. So you're probably going to have innovations on including and improving a reporting system. That's a big thing right there, having some form of reporting. And then you have telemedicine that's coming up huge after COVID, or even during COVID. It was kind of like pushed forward into everybody's face, because it was just a way of keeping hospitals that were filled to the max in capacity still able to provide care for patients that didn't necessarily have to come in person. So just to be able to come up with new ideas, to be able to help the community and help the people within its community, and even internationally, even outside of your community, that's my goal. I tell people all the time, after I found what I wanted to do and what I wanted to be, I never truly pushed for that chief executive officer role anymore. It was all about being that innovative person and possibly being a chief innovation officer somewhere.
Man, that's wonderful. And a lot of the discussions that I have today, and I talk a lot with healthcare executives in many different capacities, and sometimes they don't, especially getting out of school, you don't truly understand the requirements of the role. Like, what is a CEO? What is actually a CEO does? And CEO really is the face of the hospital system. They're the face of the business, right? They interact directly with the community. They sit on a lot of community boards. They actually answer to the board of executives that are there, the board of directors, I should say, for the hospital, and have to then present, some of the different statistics that are happening, metrics that are important for the hospital to survive. This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement in operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star business and personal branding company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand. Some people that they're not cut out for that kind of role. They're really into operations. You know what? Maybe what you're describing is you love the operations of the hospital, and you want to see how everything works together and motivate people to have better positive outcomes. And then what you're talking about around innovations, man, that right now, that is a key position for a lot of hospitals as far as the transformation of these hospitals as they move from fee-for-service to value-based care. They've got to be more innovative in what they're doing. And you'll see that the business now doesn't look at the IT side of things as just like a facilities management. They just keep all the systems working, everybody's fine. They now see them as a key differentiator, a competitive advantage that we've got to be able to marry our operations and our information technology as part of the general workflow, especially as you get into research and development. So I applaud you in what you want to do as far as being that chief innovation officer. That's going to take you a long way.
Definitely, man. I appreciate it.
Oh, for sure, for sure. So let me ask you this: if I'd ask you this, which is, what are your beliefs about how you should live your life and then conduct your work? What gets around to your ethics? How do you see things, and what you want to incorporate into your own personal code?
Yeah, so for me, the base of everything, like I mentioned previously, is learning and growth. But on top of that, there's the idea of you just got to do things with kindness and caring in a caring fashion. And then you also have to know what's right from wrong. There's going to be times, I believe, in the future that I'm going to be faced with situations where it's either going to be care about money or care about people. And I know who I am as a person. I'm going to go for caring for people 11 out of 10 times. So and I know that I'm going to stand firm with that 11 out of 10 times, just because that's how I hold myself accountable for what I truly care for doing, and that is making other people happy, making other people satisfied, and having that kindness to still look back at it and not worry about necessarily my pockets, because that might be something that might come back and hit a health system financially, but I know morally it kind of clears my conscience, and it kind of makes me understand that at the end of the day, this family might not have been in a position for them to even receive care somewhere, but now they're able to receive that care that they could have potentially been life saving or life threatening if they did not receive that care. Even to the extent of access, there is so many people out there that might live rurally or kind of remotely from a large health system. If you think about it, in Miami per se, you have places like Homestead that might be spread super far from healthcare systems, or you have places like downtown that have a health system right across the corner. So there's going to be different things that are going on and different experiences for these people. So in my mindset, no matter what I do, I want to think of, first and foremost, learning how to, and going back to access, learning how to mend that issue of access for maybe that person that's in Homestead, understanding, okay, maybe this is somewhere I leverage telemedicine with or telehealth with because we don't have a health system over there. Maybe that's a possible way we can get out there and reach out there and provide some form of care. Or you might have the mobile trucks, or you might have a mobile bus that you might be having going out there, or some form of mobile clinic. That's where you can come in and you can try to bridge that gap of access. And it might cost money, where I mentioned it kind of goes into the idea of doing right for wrong. But at the end of the day, you know that you need to be able to help these people and these individuals, just because it's the right thing to do. So I'm going to always stand by for progress, learning, forever trying to grow. And then also knowing that I always have to do right from wrong, no matter the consequence that might occur from it. I can't let my morals or my ethics go to waste over something that might financially burden me or financially burden something else down the line.
And that's the crutch of the matter. And you'll find that in healthcare, they have to make decisions, life and death decisions, based on some of the things that you just talked about. How can we maximize care? At the same time, we have it maximized our revenues and our income. And that's where the innovation is going to come in. That's the part of the secret sauce that people are looking for, is like, how can I make money when my primary goal now completely is to create value for my patient population? What does that look like? And you've got to make, those changes, and you can't, that status quo, that the way we've been doing it all the time, has to be looked at, and they need that fresh perspective. Like, okay, you know what, our major, mission is to provide, extraordinary care for a population. So you have to start looking at the business overall and what can be changed, that's not maybe patient facing, that can now add to the bottom line as well. So you start getting into micro hospitals. You start seeing that more and more now. So you don't have large facilities with bunches of beds. There's a lot of home health that's taking place now, and more mobile health that's taking place now. So all those shifts and changes in the business model is something that could truly take place. And I'd love to see you to be a part of that.
Oh, definitely. I plan on it.
If you don't mind, because I have a
Yeah, man.
question, how would you describe the difference between getting a MHA, Master's in Healthcare
Mhm.
Administration, as opposed to a PhD in Public Health? What's the difference?
That's an interesting question. It all came down to me on just the inquisitive nature that I have. I'm curious. So if someone is gonna tell me and teach me how to do something, I want to know the reasoning behind it. And I think that's really the main difference. With the master's in health administration, you're gonna learn everything you need to know about running a health facility. You're gonna hands down, depending on whatever program you're in and how seriously and how rigorous you take it, you're going to be prepared to run a health facility. But going in towards my PhD, I look at it as not only do I feel as if I'm going to be prepared to run a health facility, I look at it as something now, okay, if a problem occurs or there's a health issue, I have the backbone and the skills to now go research how to solve that problem. So now I can look into, okay, there's like going back to access, there's access issues in the neighboring community. How can I further their education? How can I further their opportunities to gaining that access? I might be able to now have my own paper where I'm doing probably a literature review. I could do a systematic review. I might be doing something along those lines. Or you might have an actual intervention that you come together as a team to create. And now you're going to go test it. And you're going to use statistical analysis and things of that nature to now see maybe this intervention works. Maybe it doesn't work. Is this intervention cost effective? There's so many different problems or different ways you can take an issue, because you can make it quantitative, like I said, with is it cost effective, or then I can actually go out in the community as well and do a qualitative result, get like qualitative results, and see how does the community feel about it. Go and ask questions and have small focus groups. Maybe the community doesn't even know about it. So that's something that you could write down as well. So having that PhD background, I feel as if not only prepares me enough to be able to run a health facility or some form of health facility, but it allows me to branch out and kind of get that creative nature, like I mentioned, and create new solutions myself.
Oh man, that was a great description, great definition of the difference, and that bold. I see where it aligns with your passion and where your energies are located at their most high. That's great. I want to ask you, tell me more about this city year. You were an impact manager there.
Yeah.
And I'm not sure what kind of work you did there. If you could let me know about that, I think the audience would be appreciated.
So yeah, when I was working at City Year, I was actually, like you mentioned, an impact manager, and that is actually a nonprofit in low resource areas for the most part. So in this opportunity, I was actually kind of helping mold and teach and mentor young adults, typically between the ages of like 18 and 23, 24. And they were going back and they were advising, tutoring, mentoring young adults in these low income and low resource schools. So specifically, I was at Madison Middle School and I was at Miami Senior Edison High School for the most part. So I'm working with administration in these high schools to provide additional servicing and supplemental services towards students, so they can gain whatever educational need they might have, or they can also get some form of life lessons as well, from the actual mentors that they may have, and based on the bonds that they get with these individuals. And it was an interesting experience because you definitely see people grow through the time, especially being a young adult myself, to see other young adults kind of come together for a better cause. It's something that's very enlightening. And then it opens your eyes up to the various needs that certain areas do have. And it makes you just want to help even more and trying to help with certain things, like maybe like health disparities or things of that nature, because those things exist in many different facets, and education is one of them.
And I think that, so that's where the rubber meets the road. You're not just getting the book knowledge about public health. You're out in the field You're seeing real
Yep.
time, what's going on in the lives of these individuals.
Definitely.
And then, as you return back to your facility of what you're doing, like, wow, this is how we can truly impact, patient outcome and preventive health and that type of thing. And so I applaud you. I applaud you for that, for sure. So let me ask you this. Now you're about to graduate, I believe in like 2022.
Hopefully 2022.
What's your ideal job look like? What do you think you want to step out of, the world, the student world, and you step into industry? What do you want that job to look like?
Ideally at first I'd want to be probably somewhere either in a community-based area or a community-based department, or in like a research and quality type of department. A lot of my research right now is on patient safety culture. So I do actually look into the area of how staff feels in terms of their organization's beliefs, values, actions in the area of patient safety. But on top of that, I also do believe there is a dire need in healthcare, which is in terms of staff. There's a lot of staff out there. There's a huge shortage, and there's been a huge shortage in healthcare staff for a while. And I think the COVID-19 pandemic kind of pushed it in the forefront, and we didn't realize it. And then on top of that, there's the appreciation for healthcare workers that I feel is lacking. I don't know if you noticed it in the beginning of COVID-19, you had a lot of hero commercials. As we round out towards the end, those kind of died down a little bit, and you don't see them as much. And to me, it's like, I don't think the public realizes that COVID-19 isn't the only thing that healthcare workers fight on a daily basis before the pandemic, and even now during the pandemic, and then even after when it's going to pass. There's still going to be other life-threatening things and life-saving actions that these healthcare workers are going to have to do. And they're going to be stressed out, they're going to be burnt out, and they're working really, really long hours. So I do find a passion in terms of educating and trying to bring up the next future generation of healthcare workers. So that's a field I'm interested in as well. And that could probably fit in like quality or community, kind of could fit in both of them. Because I do believe in sort of that local investment in terms of local health systems and reinvesting in their community and educating maybe high school students or educating college students on healthcare careers. So that way, when they're going to college or when they're in college and they're deciding on, okay, I'm kind of confused, I don't know what to do, what should I do next? Oh, the health field is there. This is kind of a way that you kind of hit the health understanding and health education by teaching maybe someone in low incomes or lower resourced areas about health. So now that you're facing these health discrepancies and these health disparities, now they're getting a little bit more health education. So they're now knowing how not only a future career, but they're learning how to eat better. They're learning how to live better. They're learning all these other tools that might give them a healthier life on top of that. And then if you're giving them enough education now, you're talking about them potentially following and having a career in health. Now this is a return to the economy, and you're bringing more money and more revenue into a local area that couldn't necessarily probably have as much resources as before. But now, since their health system started investing in them, now they're learning and now they're getting even higher goals and expectations than they could ever thought would be even imagined. So that's kind of where I look at it, and my mind just processes things. It's kind of like I want to be that person that comes in and comes up with ideas to give back to the community in a way that is going to make the community overall more healthy, not just thinking about if they have to come to the hospital, are they going to get better? I want to think about after they leave the hospital, before they come to the hospital, everything in between. So that way the whole community lives a healthier life.
Oh my God, that's it. That's that full life cycle of care.
Definitely.
I truly believe the industry is moving toward that. I just talked to Chinmed Medical. They're one of the few. They're a national outfit. They're headquartered here in Miami Gardens, and their whole model is on value-based care. Yeah. And they work with the elderly and the poor, people that are on Medicaid and Medicare for the most part. But that might be something, if I were you, I'd look into. I think you align very well with their mission and vision, for sure.
Yeah, and I can imagine all the issues they have to face, because it's evident out there that, you have an aging population. So with the aging group, you have people getting older. So you're gonna have to face all those problems you're gonna have to deal with in terms of access to care. You're gonna have to deal with payment for care. Like you mentioned, all these things are gonna be engulfed in value-based care. And even with that, now you're gonna talk about health disparities with value-based care. So you're gonna have to address health disparities to have a complete controlled system that is gonna work great. And I've seen the things that ChenMed did, and they're hard to beat, man. And they're on top
of
everything. When you think of senior care, like literally they're the first ones you think of in terms of specialists.
Absolutely. No, they are a market leader, and I truly applaud what they've been doing for sure. So I see where your passion lies. It flows all the way through. You're very, very professional. You're looking to make opportunities for others. I believe that's wonderful. You're on a continuous progressive track. And you also stated you're very relaxed, and I see that. You're very relaxed, you're cheerful, inquisitive, all of those things that when you look for a well-rounded person and a leader, these are great qualities. So I'm going to conclude our call at this point. But before I do, if there's anything else that you would like to share with our audience, this is your moment.
Yeah, man, it's just a matter of everybody realizing it's important to care for one another and educate each other on different areas, and especially in health. There is so much to learn. And once you start looking into learning health and the different areas of health, you just start, I guess, sort of digging that rabbit hole. You don't want to go too far into it, but you kind of understand how to live a healthier life, how you can help others in the community, and how you can continuously have your family grow from there. And I feel like once you fully get that and you fully grasp truly understanding how to care for each other and educate each other, then you're going to talk about communities growing, might from be a small level at first, but then it's going to start growing, and it's going to start having that exponential growth of learning and understanding how to be healthier all in one, in terms of a huge community, in terms of going from a community to maybe a city to a state, country, and then it just keeps on growing from there. But it all just takes learning and caring for one and each other.
Man, that thank you for stating that. And you, to be a young man of 25 years old, you've got great learning, great potential, and I look forward to seeing greater success for you here in the coming years. I encourage all of our listeners to continue to follow the brand. We're building a 5-star brand that people can follow. That's part of our tagline, and we want to bring more meaningful content. You can continue to follow us on all the greatest podcast outlets, like I think on Audible, as well as iTunes, as well as Spotify and Buzzsprout. You can also go to our website at www.5starbdm, and then you can go ahead and download the player on the site. So thank you very much, Jayson, for everything you've shared. And for our audience, we will tune in to you next week. Thanks very much from Follow the Brand.